we are back at the Hack-A-Thon right here in St. John's. I can tell you, there's a lot of creative things happening.
Incredible.
Incredible, isn't it, Jim?
It is, it is.
A lot of incredible things happening right here in the Hack-A-Thon with the Bounce Health Innovation Group. And
right down there.
Bounce Health Innovation has got a lot of great companies and a lot of good things happening in Newfoundland, in the technology sector, in the medical technology sector. So, Robbie, why don't you go ahead and tell us a little bit about yourself?
So about myself, so my name's Robbie Thomas and I come from central Newfoundland, born and raised in Southbrook, Newfoundland. When we actually graduated, my grad class graduated in 2020, the year that COVID first shut everything down. Yeah. So when we missed our grad and everyone was in a panic trying to get off to university in the midst of this brand new pandemic that everybody was freaking out over, I decided not to go right to university for my first year. I took a year off and I approached Dr. Young and I asked, what service can I provide for you for the next year or so while I'm taking a break from
Who's Dr. Young?
School. So Dr. Young is the owner and operator of Medicuro.
So where did you meet him?
So his son and I are good friends and grew up together. So I knew that Dr. Young was always looking for new ways to make an impact in healthcare.
What kind of doctor is Dr. Young?
Oh well, I've never met another one like him.
Is that right?
He's the hardest working doctor that I've ever met, and he takes a whole different approach to it. I've noticed after working with him so closely. He looks at it as, well, if I don't go the extra mile and maybe pick up some of the slack of the healthcare system right now, then it's not the physician who suffers for it, and it's not the policymakers that suffer for it. It's Aunt Mary down the road who can't get her blood pressure medication, or it's Uncle Vern up the road who's having trouble with his hip and he can't see a doctor for 2 or 3 weeks.
So you finish high school, you take a year off, you figure, I'm going to help this fella out.
Yeah.
Because he's your buddy's dad, right? And you said, I'm going to go help him out. Right. Dr. Young says, okay, come on board.
Dr. Young said...
So this is this relationship, how it forms.
Right, yeah.
Right on. So tell me about the company.
So Medicuro is Newfoundland's first virtual doctor's clinic. So what we do is we try and accommodate all those who are having difficulty finding quality health care. So for underserviced and remote and rural areas, people have a hard time, getting into a doctor's appointment because they make a call, they make an appointment, they can't get in for 3 to 4 weeks when their issue, needs to be taken care of almost within the next few days, right?
Right.
And you can go and try and go to Emerge, but then we have people saying, I've been waiting 6 or 7 hours here in whichever hospital, and I'm still not taken care of, and people are getting really frustrated with the way healthcare works in this province right now.
Yeah.
And we've actually seen, we've gotten requests come in to our from our webpage stating that they're in the ER right now waiting, and we've done, we've set them up with an appointment. We've got them seen right there virtually through their phone while they've been sitting down in the waiting room waiting to go in and see a doctor.
So give me a snapshot of exactly how your service works, exactly what you do.
So a request comes in from the webpage, and we get it in an email, and we communicate with the doctors, and we ask them their schedule, and we get the time that they're working, and then we book the appointments for whatever time that is, and book them into our own EMR, and the patients are able to connect with the doctor from there. They get sent a link, and then 5 minutes around their appointment, 5 minutes before their appointment, they join on, and they're there face to face with the doctor.
So it's all virtual medicine? It's
all virtual medicine, yeah. So 98% of all appointments booked through Medicuro are done virtually. There's done by video.
Yeah.
There's a small number of those who still need to do a phone call appointment, say, just because they don't have access to a smartphone, or they don't have a reliable internet source.
Yeah.
So
what I'm going to geek out here, freak. I know Jerry wants to ask this question. What platform do you use for the video?
So we actually use we're the first virtual health clinic to operate within our own EMR.
Okay.
TELUS EMR. It's electronic medical records, and inside this system we have a virtual module that allows us to do it all in the same system. So while the doctor is looking at the patient's chart, they're also set up with their video in the same system.
How,
wow.
How old is the product? Is this?
So the company was started in 2019, but when we acquired our own account on our EMR, that was around probably a year and a half in.
Okay, unbelievable, man. You come right out of high school and you start right into this and making a significant impact. How's that feel? Like, that's got to feel like $1 million bucks.
It's the most rewarding work that I can do, and to get the feedback from the patients, it really goes a mile. When you're able to accommodate for their issue and for their circumstance, and you get back the big thanks and the big praise, it's so rewarding to know that you were able to help when no one else could. You were able to help when the circumstance was so unfortunate that they couldn't get in to see their own doctor, or they had to wait for hours on end, and they were feeling neglected and not taken care of. And it's so rewarding to be able to accommodate that.
Robbie, you're entering Memorial University in a different way.
For sure.
You come in here with a product, with an idea, with a solution that's going to help people.
Absolutely.
You're not like you're walking in to go to your first year classes here.
Yeah, it's a bit weird. I funny story actually. I remember going into my first semester, and I walked into English and before, and in the email that I used to send out for to offer an appointment time, my name and my contact information and email was at the bottom of that. And I remember going in and my English prof, getting to know each other, asking each other's names, and I mentioned my name, Robbie Thomas, and after the class he waited and he said, by the way, are you the same Robbie Thomas that books my doctor's appointments? I said, yes, actually I am. And he was so caught off guard. He didn't know what to do.
How do people get access or to have a look at your product? How do they get access to it? What's the easiest way?
So we have a web page, www.medicuro.ca, and we also have an app on the App Store.
Spell that.
Medicuro, Medicuro. Yeah.
Medicuro. So they go right on that web page or an app.
Yeah, they can go on the web page or an app, and they'll hit a big button that says Book Now, and they'll be guided from there, put in their name, email, and just so we can contact them and go about setting up to see a doctor.
It almost seems too easy,
Almost,
but it's like you've explained it so well, Robbie. You are well on your way to some incredible things. Gale Force Winds is here today to bring stories like this out, and I'm just blown away by what it is you're doing. Keep doing what you're doing, my friend.
Thank you very much. Yeah.
19 years old, Newfoundland, Labrador, it's in good hands.